Good morning. Since the public health emergency began, our goal has been to provide all students with the world-class education that they deserve, while also maintaining a health and safety environment in our schools. These priorities have not changed, but our enrollment and attendance data highlight disparities that we must do everything within our power to address. Thanks to the hard work of our educators and school leaders, our students' online experience has improved dramatically since the spring. However, it cannot replace education in the classroom with a highly qualified teacher in person, especially when we're talking about our city's most vulnerable students. Data from the first 6 weeks of schools shows that our youngest learners, as well as our students in our special education cluster programs, are not being served well enough with online learning. To truly reach their potential, these students need to be in the physical classroom, interacting with their peers and learning with their teachers. This is an issue of equity, plain and simple. We all know that transitioning back to the classroom is a difficult decision. So while we will begin the second quarter learning at home, our goal will be, and it must be, to reopen our school buildings for our most vulnerable students as soon as possible. Having worked closely with Dr. Already and the CDPH team since this spring, we believe that we can safely reopen schools for pre-K students and students enrolled in our moderate and intensive cluster programs later this quarter, in the second quarter. Families who are not ready for their children to return to school will have a choice to remain at home and continue learning remotely. We will also continue to explore a phased-in approach for the other grade levels, hopefully beginning at the beginning of 2021. But for now, we are squarely focused on our pre-K students and students in our cluster program. In a moment, we will hear from Dr. Arwady about what we've learned from other school districts, as well as the public health situation here in our city. We will also hear from Chief Education Officer Latonya Mcdade on the academic details of our plan, as well as Chief Operating Officer Arnie Rivera on all the things that we've done to ensure that in-person learning is safe in our buildings. Before I turn things over, I want to be clear about one thing. Providing in-person instruction to our most vulnerable students is truly an issue of equity, and we will do everything within our power to ensure that these students are properly served. My hope is that we continue coming together as one CPS family, and that we will not let the challenges that have been thrown at us by COVID-19 derail the amazing academic progress that Chicago Public School students have made over the past few years. It is now my pleasure to introduce Dr. Allison Arwady, the Commissioner of the Chicago Department of Public Health, to the podium. She is an expert and has been leading the city through the COVID-19 pandemic response. Dr. Arwady.
Thank you, Dr. Jackson. The Chicago Department of Public Health has been focused on COVID cases in children and child-focused settings since very early in the outbreak. We have a dedicated child COVID investigational team at CDPH, staff with training in pediatrics, pediatric infectious diseases, case investigations, epidemiology, infection control. We talk regularly to our counterparts in other cities, and we follow closely all COVID information related to children and those who care for and educate children here in Chicago, but also across the state, the country, and even the world. And by and large, what we have learned related to children and to risk in schools and child care settings has been one of the few good news stories of this pandemic. It is in this context that CDPH offers our full support to the CPS phased plan, even as we continue to monitor closely the current rise in COVID-19 cases in Chicago. Our whole response has been about following the science, adjusting our response as we learn more, and limiting and balancing risks. This is no different. So first, let's talk about Chicago. For many months, my team has worked to investigate any COVID infection diagnosed in a Chicago resident under 18, with a particular focus on any public setting where children gather. For many months, we've investigated cases here associated with daycare, childcare, and athletic settings. We've investigated summer camps and summer programs, including those that the Chicago Parks District successfully operated this summer. And importantly, my team has put a special focus on investigating COVID-19 cases among the thousands of students who are right now attending in-person private and parochial schools in Chicago, as well as the staff at these schools. And the data shows us that when the proper precautions are taken, transmission in these settings is rare. Chicago students who have returned to the classrooms in these parochial and private schools have actually had a lower rate of COVID, about half the rate detected than their counterparts in the community. To give you a sense of the scope, right now the Archdiocese has nearly 20,000 students in school in person here in Chicago, along with more than 2,700 teachers and staff. In September and early October, they have reported, and CDPH has helped investigate, COVID cases in 31 schools. But just as we have seen with daycares and camps, the majority of the time, the number of COVID cases that end up being associated with those schools is 1, meaning that we do not see transmission within the school. We do have ongoing community transmission of COVID here in Chicago. We've seen many examples of COVID infection when kids and adults gather in social settings outside of school, particularly if they are not wearing masks and distancing. But that school community of nearly 23,000 people in Chicago has broadly been doing a good job of following the safety protocols in the school buildings, from masking to cohorting to cleaning to responding appropriately when cases are detected. When we look at potential spread in these classrooms and school buildings, we have seen less than a handful of situations where we could not rule out transmission in the school setting. Where we have seen multiple cases at a school, for example, it is most commonly because siblings attend that school. We've seen much higher rates of spread in settings outside of schools. Secondly, let's talk about what we've seen around the country. CDPH has been closely watching the emerging national data on COVID risk in schools, and we've seen that many states and cities around the country with much more poorly controlled local outbreaks than we've had here in Chicago have continued in-person education. And the data there, too, has shown that where schools have strong mitigation practices in place and a rigorous commitment to maintaining them, the risk of COVID spread is low, and often lower than it is in the community at large, just like what we've seen in Chicago to date. We continue to learn about COVID, but study after study has found that U.S. daycares and schools with protection measures in place have not been as significant a source of spread of COVID-19 as we had earlier feared. Just yesterday, for example, a large study was published in Pediatrics, the journal of the American Academy of Pediatrics, focused on the child care setting, which of course has relevance where we're talking about our youngest pre-K students. It asked whether the adults who continued to care for young children in these settings during the pandemic were more likely to be infected with COVID. Surveys of more than 57,000 child care centers across all 50 states found that, in fact, providing direct care for children in child care settings was not associated with a higher COVID risk among the staff who watch these children all day. Again, this is because protection measures have been put in place. And finally, on a personal note, I've worked on many outbreak responses in my career. Outbreaks tend to bring long-standing inequities into the light, and their indirect effects can linger for years. If and when an outbreak is truly out of control, slowing it absolutely must take precedence. But as outbreaks evolve, we learn more about the activities and exposures that are at higher risk. We direct resources. We learn how to change our behaviors and change practices to limit spread. And in that setting, we have to talk honestly about what it means to limit, not eliminate, risk. because the indirect impacts are also very real, and these impacts often fall hardest on the people with the fewest resources or the highest needs to start with. So just as I believe that health care is both essential and a human right, I believe access to education is essential and a human right. And as a pediatrician, I remain the most concerned for our youngest children and our children with special needs, who frankly are the least able to access education through screens and have the most to lose. So starting with this plan to phase in these students first makes sense. COVID cases are on the rise here in Chicago, around the state and around the country. At this point, though cases are certainly increasing, we do remain well below our peak period for last May for COVID cases. Severe COVID cases in particular are way down. Hospitalizations and deaths right now are down about 90% of what we were seeing from the peak in May. The city's test positivity rate is currently just below 5%. And according to the CDC, that community test positivity rate of 3 to 5% represents a lower risk of transmission in schools. A positivity rate of 5 to 8% represents a moderate risk of transmission in schools. A positivity rate of 8 to 10% represents a higher risk of transmission in schools. And we have seen settings with schools open with positivities well over 10%. CDPH will continue, obviously, to monitor our local outbreak and emerging national data very closely. If we end up needing to put stricter restrictions in place to control the outbreak, we absolutely will. This could include needing to delay further in-person education, but I certainly hope not. We are confident in CPS's plan to start rephasing in-person education safely, based both on our Chicago experience and what we've seen around the country. We're confident in their strong protocols around symptom screening, mask wearing, social distancing and cohorting, hand hygiene, environmental cleaning, and other measures. We're confident this preparation will be paired with appropriate case investigation, contact tracing, testing, and quarantine when cases are detected, and CDPH will support in this. I'm a pediatrician. If I thought this plan was dangerous, I obviously would not be supporting it. My and CDPH's only goal is to protect the city of Chicago, to balance the direct and indirect effects of COVID, to address equity, to put the health and safety of students and staff first, and to get all of us through this as safely as possible. And with that, I'd like to introduce Chief Education Officer Latonya Mcdade.
Good afternoon, and thank you, Dr. Arity. I think it's important to acknowledge that CPS is not alone in what we're dealing with right now. All over the country, we are seeing students falling behind, with the greatest impact concentrated among the nation's youngest learners. We're seeing this in large districts like Los Angeles and Philadelphia, and even in smaller districts in Iowa and other parts of the country. Right here in Illinois, the Archdiocese of Chicago has reported a significant drop in pre-K enrollment. The drop we are seeing far outpaces enrollment declines in prior years. So it's clear this is because of the ongoing COVID-19 pandemic. Study after study has shown us how important early childhood education is to the student's future. So we need to do everything possible to reverse this trend. Our teachers are definitely doing a phenomenal job with online learning, but it is not ideal for any student, especially our very young students and our students in cluster programs. It is particularly hard for our working families because they do not have the ability to sit side by side with their children during school hours. For students in our cluster programs, reopening school buildings goes beyond academics and social emotional learning. It will allow them to receive critical therapeutic services like speech, occupational therapy, and physical therapy, all of which are critical to their success. But even with all the good reasons to do so, we would not reopen schools unless the science indicated that it is safe. As Dr. already stated, The data supporting this reopening is encouraging, and we will continue to monitor the public health situation closely to ensure the potential return of students is done safely. Of course, we know families who are not yet comfortable sending their children back to school will have the option to continue learning remotely. We will continue to support them and provide all of our students with a high-quality education. As the leaders of this district and the people who are responsible for ensuring Chicago students receive the best possible education, there is no question that our students need to be back in the classroom, which is why we've set a goal to begin bringing them back next quarter. I will now turn things over to our Chief Operating Officer, Arnie Rivera.
Thank you, Chief Mcdade. Let me first say that our facilities and capital teams, as well as our outstanding engineers and custodians, have been preparing since the spring to welcome back students and staff to our schools safely. In these past 6 months, we have established policies and procedures that rely on guidance from the CDC and leading industry leaders to help keep everyone safe in our buildings. A few examples. Cloth face coverings will be required by everyone at all times, and every member of the CPS community will be provided a set of these coverings. Students and staff will be grouped in pods to allow for appropriate social distancing and to make contact tracing an easier process. Temperature checks, hand washing, and daily symptom screenings will be required before students enter the classroom. Testing will be made available for free to any student or staff member who is symptomatic or who is a close contact for someone who has tested positive for COVID-19. And a new group of dedicated staff will work in coordination with our partners at CDPH to ensure rapid contact tracing is conducted. We've also made significant investments to keep everyone safe. 400 additional custodians are being hired to make sure comprehensive cleaning protocols are completed daily in each one of our schools. Over $3.5 million has been spent to secure more than 50,000 hand sanitizing stations in all high-traffic areas and classrooms, and soap dispensers to support regular hand washing and sanitizing. Over $2 million has been invested to purchase 86,000 containers of EPA-approved disinfectant wipes for classrooms, offices, and other high-touch areas. And a hospital-grade disinfectant sprayer is now at every CPS school. We've also been carrying out a multi-step initiative since the spring to ensure that schools are properly ventilated, which is an important step to prevent the transmission of COVID-19. This year alone, we've already spent more than $65 million in facility improvements to promote proper ventilation. And to ensure the district only uses classrooms that are properly ventilated, we are in the process of conducting an assessment of every single classroom in the district. On top of that, we've contracted out with 3 independent state-certified environmental hygienists who are conducting their own assessment of air quality in all of our schools and are raising issues that need to be immediately addressed. We will make these reports public in the weeks following their completion, and we are fully committed to doing everything necessary to ensure that no student or staff member is in a classroom that does not have proper ventilation. Our approach to health and safety is based on the best available public health guidance from local, state, and federal officials. And CPS will be ready to safely support students as soon as we are ready to resume in-person instruction. Thank you, and I will now turn it back to Dr. Jackson.
Thanks, Arnie. We'll now take your questions. Okay, dokie. All right. Hi. Mm-hmm. Yeah. Yeah. Well, today we released data about our enrollment for this current school year, and this is the largest drop in enrollment that Chicago Public Schools has experienced in the past 2 decades. More importantly, we've analyzed this data to see who isn't enrolling in our schools. And one of the troubling statistics that we see is that far fewer pre-K students are enrolling, and we see the largest impact amongst African American students. The reason this is significant is obvious, but one thing that I'd like to call to everybody's attention is the past few years, the efforts that we put in place to introduce an early learning program, pre-K for all, across this city. And we've seen remarkable academic progress and socialization for our most vulnerable students as a result of those efforts, and now we're seeing a reversal of that due to COVID-19. I would also like to note that while we are retaining more of our students, which is something that gives us great pride, the fact that we see fewer kids enrolling is troubling, and we must respond to that in order to preserve the things that matter most to us here in the district. Yeah, the plan that we have has always prioritized options for our parents. We understand that COVID is a changing dynamic. We're learning things every single day, so it's imperative that parents have an option. And along those lines, parents need to have an option to have in-person instruction for their students. We've heard from parents consistently throughout this process about their concerns with students returning to school, but I've equally heard from parents who feel very concerned that they want their kids back in the classroom with their teachers because they know that that's an optimal learning environment. Yeah, what we stated today and we're committed to is we want to see a return to in-person instruction. What we've learned is that we have to be very thoughtful and deliberate about that process, so we are letting the data guide us on that. We're starting with our students who are the least well-served under a remote learning environment, our pre-K students and our cluster students, but we are also going to start a process this second quarter for bringing back our elementary school students as well as our high school students. Similarly to what we've done in the summer, we will be surveying parents. We will be looking at workforce analysis to make sure that we can pull this plan off. But the message that I have to parents is that I'm not throwing in the towel on in-person instruction. We're going to do everything within our power to get our kids back in school, and we're going to do that safely. 2021 for the other grade levels is what we're looking at, early 2021. Okay. I think when you look at the enrollment challenges that we pointed out today, it would be irresponsible not to respond to that. When I look at those numbers, what I hear parents saying is that I don't think there's an option to educate my child. And as a school system, we must respond to that. But I think what's important is the social issues and the equity issues that are at hand here. We stood up a remote learning environment to respond to COVID-19. We should not create a new system that replicates the inequities that our kids already face in public education in the United States. When we look at the data, we see fewer students in African American communities, Latinx communities, low-income communities participating, and it would be irresponsible not to respond to that. So absolutely, the enrollment matters, but what's underneath that enrollment matters most, and that's an inequity issue that we are responsible for addressing. Well, I'll let Chief Rivera respond to the building facilities issues, which I think he did a good job giving an overview of what we're doing. But what I'll say is this, and I said it in my remarks earlier, I would hope that as we respond to these unprecedented times that we can do this collectively and as a family. At the end of the day, this is not the time for the district and the union to go back and forth with one another. Parents want real solutions and they want options. I want to see an opportunity where we are having a real conversation about how we educate students. I'm also gravely concerned about the union's leadership almost inability or intentionality to not address some of the equity issues that we're raising. When you see numbers like this, when you see our most vulnerable students, the students who need the most support in Chicago, not being served adequately, I would hope that they would stand side by side with us in order to address that. There are definitely issues that must be worked out, and I'm a big believer that we have to do that together. But at the end of the day, there has to be some common ground. And as educators, I'm an educator, they're educators, the primary focus is making sure that our kids get the education that they deserve.
That $1 billion figure is inaccurate, and when I noted earlier that the $65 million to date that we've spent, that's just purely on upgrades and replacements to the elements of our mechanical system related to ventilation. We have spent significantly more money since that in addressing preventative maintenance, routine maintenance. We have professionals, in the engineers at the school level, contractors that are making sure that we're taking the time afforded to us now, since the spring, to not have people in the building, to ensure that the employees that are currently in the building, as well as when students return, our buildings are as safe as possible.
Yeah. Well, first, let me say that's an extremely unfortunate and also disturbing situation. Chicago Public Schools over the past few years has worked extremely hard to create an infrastructure that better supports and provides safety for our students with regard to sexual assault, harassment, and harm. I think that the data is clear that students need to be in school for a variety of reasons. It is more than the brick and mortar. It is more than just the education. We provide a lot of basic needs for our students, and safety is one of them. Oftentimes, a teacher or a counselor or a trusted adult in the school building is the first person to identify an issue that a student may be facing. DCFS has already reported a dramatic decrease in the number of cases reported. We know that these things have not stopped occurring, but what has happened is there are fewer watchful eyes looking at students, connecting with students to make sure that they're safe. So this situation is definitely disturbing, something that has been unsettling to me personally since I heard about it, but I also think it just makes me even more committed to seeing our kids back in school under the watchful eye of their teachers who care for them deeply. While I can't provide a specific number because obviously that varies school by school, what I will say, this is the reason why it's important for the district to make our intentions known now, and then it's going to take us a few weeks to collect that data. We will start by asking parents to opt into in-person enrollment. That's going to give us a correct figure about how many students we should anticipate returning to our schools. Likewise, we will be asking teachers and staff members to complete an intent to return to work form. And again, that's going to give us more data as well. Where we see issues where we need additional staff or substitutes, et cetera, in order to support in-person learning, we'll be able to move quickly and provide that coverage in those schools. So that's the reason why we need to make our intentions clear and then give us the runway to put the plans in place. We actually plan to do that. I think it would be, the question is around whether or not we should survey parents. We absolutely plan to survey our parents and use this opt-out registration form that I talked about earlier. But we have to provide them with a plan and give them something to react to. We've spent the past 6 or 7 months engaging with a variety of stakeholders, talking to thousands of parents, fielding hundreds of questions around this. But what we put out today is a restatement of our plan to see students return to school and to also get parents' input around what that should look like. Another unique feature that's important to note is that we are asking individual schools that have cluster programs and pre-K programs to host sessions with parents. There's only so much information I can provide at this 30,000-foot level. We have to make sure that the students are, that the principals are talking directly to families so that parents know what will in-person instruction look like in my child's actual school. Yeah, I would say, and then I'll turn it over to Dr. Arwady to further elaborate, but our plan is a citywide plan. We are going to be looking at the health data as we've done throughout this process, and also looking at our staffing at each individual school and parent comfort with the plan. Those are going to be the drive-in forces. As it's clearly been stated, a lot of the spread in the community, we're not seeing that show up in our schools at the same rates, but I'll turn it over to Dr. Arwady, who can speak more eloquently.
Yes, The only thing I would add is that we are absolutely planning the same approach across the whole city. It's been a major conversation nationally around whether we should set different standards in different parts of the city. And what we've seen is that in a city that is broadly mobile, where we have people living in one area and working in one area, where we have students living in one area, in some cases going to school in another area, we really want to make sure that the plans that we put in place have the appropriate safety precautions for the community that surrounds them. And that is true in every community in Chicago. We're confident that these plans that are in place will serve some of the community areas where we're seeing high transmission rates, just as we are confident that they will serve areas that have lower transmission rates. We are concerned about COVID across all of Chicago, and I don't want to give an impression that there are parts of Chicago that don't need to worry about COVID. So we're taking a full city approach, and we believe that is the best approach from a public health perspective. Yeah, I think we've been very reassured to see that where the Archdiocese and many of the other private and parochial schools in Chicago have come back, they've followed a very similar plan to what CPS has put forward here. And we have really seen very good success in terms of controlling COVID-19. I think certainly we were feeling relatively reassured about this over the summer, where we've been watching very closely daycares. Like I said, the Chicago Parks District successfully ran large programs with many children moving around, masking, can you actually do this in practice? But having seen the opportunity right here in Chicago and broadly having seen really good success with recognizing that COVID is part of our lives here in Chicago, but that we are able to continue with essentials, and that can include in-person education with the appropriate, careful mitigation measures. Yeah. So the virus is not harmless. And the concern here is that as we are seeing this rise in cases, as you heard me say, so far we've not seen that be shown significantly in the severe outcomes. So we watch not just our cases, but we watch how many people come to the emergency department with COVID, how many people get admitted to the hospital, how many people get admitted to the ICU, get put on ventilators, and unfortunately die. And what we see is that there are settings around the country where, particularly if cases get out of control, positivity really gets out of control, often you can start to see some of those hospitalizations and death numbers lag behind that. We're seeing that right now in Wisconsin, for example. So we're watching all of these numbers very carefully together. As we talked about earlier this week, we've started to develop additional metrics to really make sure we have a good understanding in a setting where there are a lot of different new tests that are coming online and a continuous change there. I have no intention of letting COVID-19 sort of rage out of control here in Chicago. We are monitoring this with concern, and if we need to pull back, we will. Yeah, so I would point, so a couple things on that. First is that certainly at the state level, as you're likely aware, an 8% test positivity level has been determined to be a point of concern where the state will impose restrictions on businesses if a local jurisdiction has not already done that. Here in Chicago, we have at different points put stricter requirements in place than have been required at the state, but that 8% level, like what is in place right now in Northwest Illinois, near Wisconsin and Iowa, has been a little bit of a line at the state level. I will note that those restrictions have been around things like gathering sizes, restaurants and bars. They actually have not included restrictions on education at this point. I think the reason that I pointed out the CDC positivity numbers is to give people a sense that this is a spectrum. We very much would like to stay under a 5% positivity here in Chicago. I think it's possible we could see it rise above that. If we were to start getting above a 10% positivity, I would be very concerned about our ability to control COVID here in the city. But what's been interesting is we really have seen jurisdictions around this country continue to move ahead with very high positivity rates. Wisconsin had a 20% positivity rate and had not put as many of the restrictions in place as quickly as we would have done here in Chicago and Illinois. Now in Wisconsin, they're needing to open their field hospital and breaking records on deaths. So I don't intend to wait that long if we needed to move there. But it's not just about the positivity number. We continue to follow the same 8 metrics that we've been following from the beginning. Cases, how fast those are rising. Emergency department visits, hospitalizations, ICUs, ventilators, and deaths, as well as our ability to respond. What is our testing capacity and that percent positivity? What is our contact tracing and outreach capability? And are we confident that we can broadly keep this outbreak in control? I'm concerned it would be wrong not to be thinking very carefully as we see numbers go up. But right now, I'm confident that we are still in a good place, and it is the right time to bring it back to this conversation, to be planning for a month from now, hoping that we will absolutely be in a place to move forward with an essential like in-person education.
So the questions were, one, how many custodians we've hired. We announced that we were hiring 400. I think it's important to note that the 400 additional custodians that we were targeting to hire was based on full in-person. I think to date we've hired around 100. We'll make sure we get those updated metrics. Dr. Already, I don't know if you want to talk about kind of a ventilation standard relative to in-person instruction. I know that, we have, environmental contractors that have a much better understanding of this, but I think from a health perspective, I think Dr. Already can give a much better answer on that.
I can just mention, I think briefly, the top 5 mitigation requirements that the CDC has put forward for thinking about school reopening actually do not include ventilation. They include things like masking and hygiene and cohorting and contact tracing. Ventilation is an important part, but it is additional to the most important things around controlling COVID, which include the basics that we've been talking about for months, making sure that there is good adherence to things like masking, cohorting, social distancing. So certainly we applaud the work focused on ventilation. This work makes our school buildings and all buildings in Chicago even safer, but I want people to understand that it is in addition to the most important mitigation things that are in the plan and that have been shown to be successful around Chicago and around the country.
Yeah, the question is around staff capacity. As I stated earlier, the opt-out form from the parents will give us a lot of data about how many students we should expect to see in person, as well as the letter of intent that we'll get from staff. The talent office does have a centralized pool of substitutes, and we are encouraging people to sign up to serve as substitutes in Chicago Public Schools. That's actively underway, and we will deploy those substitutes in schools where we see more students that are opting for in-person instruction and where we don't have the teaching staff available to meet those needs. Again, that's a complicated process, which is why gathering this information over the next couple of months is critically important if we're hopeful to have kids come back at the beginning of 2021. I'll let Dr. Arwady talk about that.
So certainly we're continuing to figure out the details of exactly what that will look like. I can tell you that, again, we've had lots of opportunities and practice here with the Archdiocese and some of the other schools that are open. We have, for example, where there have been cases and needs for doing testing in school settings, we have partnered with clinicians in many cases to bring some of that testing on site. We obviously want to make sure that people are connected to their clinical homes if there is a need, but certainly the opportunities for testing continue to expand. We are absolutely dedicated to making sure that there is testing available free of charge for anybody in a school setting with symptoms or anybody who has had exposure to a COVID case. It's one of the best practices for controlling COVID. We've been able to do that successfully with schools that are open at this point in Chicago. We'll be figuring out the details of what that looks like once we have a sense again of the scope and the numbers and what this needs to look like. But we will absolutely be working to make sure that those resources are available. So, two pieces to that. First of all, on the contact tracing side, we think it is not just a goal, but really important to make sure that that is in place. Oh, sorry. No problem. No problem. The question was about surveillance and contact tracing. So related to contact tracing, we think that it is not just a goal, but actually very important. That is one of the 5 CDC measures that you want to make sure you have in place for safe openings in schools. Some of the work around the cohorting and the pods is meant to actually make that contact tracing easier and more effective. It limits, if there is a case of COVID in a school, the number of people who may have been exposed. And so CPS, as they said, have hired some additional staff who will be working on that initial case investigation and notification to make sure that is done appropriately within the schools. And then CDPH will be working through our traditional contact tracing procedures to interface there and make sure that where there have been exposures outside of the school setting, do the additional work to understand the further risks potentially related to COVID. All of that is in place. So I feel confident about the contact tracing plan. It's a big lift, but we've been doing a good job with contact tracing all along to date. On the surveillance side, just quickly related to testing, I think this is a space that we are watching across the country. We've seen very clearly, most obviously recently from the White House outbreak, that having a lot of testing in place is not enough to have a safe setting related to COVID. And the things that we know work are the most important things to have in place. Our primary goal at this point, again, is to make sure that there is good access to testing wherever it is most needed. That's been successful to date, and that's where we are right now.
As we've stated prior to the COVID outbreak, our goal is to have a nurse in every CPS school. Right now, we are ramping up to that, so I can get the exact numbers on where our staffing currently is, but our talent department is working to hire enough nurses so that we can have one in every school. We're not there yet, but that is a goal of the district, and of course, that has been accelerated due to COVID-19. I do want to go back on the question regarding contact tracing, just to really highlight what the district is doing. We have created a contact tracing team out of our Office of Student Health and Wellness, and we've hired 10 contact tracers who will work directly with CDPH, who has a robust system already set up, but these people will be dedicated solely to Chicago Public Schools. And we also want to be transparent and make sure that parents understand exactly what's happening in our schools, which is why we made, in addition to our CPS Reopening 2020 webpage, we are now showcasing every single COVID case related to Chicago Public Schools on that website. So I would encourage people that are interested in knowing where we currently stand to go to the CPS Reopening 2020 website, and we have that data posted. It will be updated regularly, and you can click on the graph and drill down and see those rates in your community as well as your children's school. So we're trying to be transparent, but also hiring enough staff to support this at the district level. So thanks, everybody.